Hello, uh, I'm Nelton Tobias, a medical student at KSMU Core, and today I'll be talking about personality disorders. This is a very good topic, so let's go on together. On the introduction, personality is a dynamic organization of traits within a person, and those traits determines the characteristic behavior and the thoughts of that person. Personality allows others to predict how a person would react, feel, or think in a particular situation. And usually, patients with the personality disorders have significant comorbidity with other mental disorders, uh, like like mood disorders, anxiety disorders, and the psychotic disorders. We shall see this in the clusters of personality disorders. Also, personality disorders represent an extreme variety or deviations of a normal personality trait. So this is like the definition of personality disorders. From the previous slide, we have seen the definition of personality, and this one is the definition of personality disorder. And these disorders, they are pervasive, which means they are unwelcome, maladaptive, and they cause significant impairment in social or occupational functioning. And the patients usually are unaware of their illness, which means they have a bad insight. And sometimes the patients may be ego-syntonic or ego-dystonic. Ego-syntonic means that the feelings, thoughts, and the behavior that are experienced by the patient, they are acceptable by the self, the ego. Uh, these are this is the part where the patient has a bad insight. And the other one is ego dystonic, which means the feelings, thoughts, and the behavior that are unacceptable by the self. So in diagnosis, we use DSM-5 criteria, and three criteria must be met: A, B, C. Criteria A is the pattern of the personality. B is the features, like the symptoms, and C, the disorder or the personality should not be caused by other medical or mental illnesses or the use of substance. Our own classification of personality disorders, we have they have been grouped into three clusters: cluster A, B, and C. On cluster A, the characteristic of cluster A personality disorders, they are eccentric, which means they have odd behavior. They are withdrawn socially. They are peculiar, which means they are unique, and they are familiar associated with psychotic disorders like schizophrenia. And it contains three disorders such as paranoid, schizoid, and schizotypal personality disorder. The cluster B contains also like four disorders, and their characteristics are: they are emotional, they are dramatic, they are inconsistent, which means their emotions, their mood, they are not consistent. They change from time to time. In this cluster, they are familial associated with the mood disorders, yeah, like bipolar disorder. And the personality disorders which are contained in this cluster, there are four. There is antisocial, histrionic, narcissistic, and the borderline personality disorder. In cluster C, these are anxious or fearful, and they are familiar associated with the anxiety disorders and phobias. And it contains three disorders such as avoidant, dependent, and obsessive compulsive personality disorder. But also there is a other group which is grouped as other specified or unspecified personality disorders, which means this includes the characteristics of a personality that do not meet full criteria for any of the above personality disorders. Uh, on the etiology, the cause of personality disorders, it is multifactorial. multi factors play part in order to for a person to develop personality disorders, like such as their genetic, like heritability, which contributes about 40 to 60%, high concordance in monozygotic twins, and for cluster A personality disorders, they are more common in first-degree relatives of patients with schizophrenia. The other one is biologic. There can be high levels of testosterone, also low level of serotonin metabolite, which is called the 5-hydroxyindole acetic acid. And this is associated with low mood, self-harm, suicidal behavior, and it's mostly seen in borderline personality disorder. The other factor is environmental, which means like low socioeconomic status and the social isolation can contribute to uh, person developing personality disorders. Also, in psychosocial factor, there is like low parental affection or lack of care, and this is associated with the borderline and the dependent personality disorders. Also, there's childhood abuse, like childhood maltreatment and the trauma, also can contribute to personality disorders. On the treatment, first of all, it is difficult to treat because most of the patients they have bad insight. They don't know that they are sick, uh, egosyntonic. Also, it tends to be chronic and lifelong. But psychotherapy is usually helpful, and also pharmacotherapy is used when there is a comorbid mental condition. And these are my references. You can use first aid psychiatry and mastering psychiatry exercise books. They are very good for learning personality disorders and learning psychiatry in general. Uh, I have made other videos on the clusters of personality disorders, cluster A, cluster B, and cluster C. Uh, and you can watch them on YouTube through my channel. I've explained it in very short and giving their characteristics. Thank you for watching this video. Please subscribe to my YouTube channel for more of these videos.